7. So, with an estimate of 480,000 people worldwide actively living with sarcomas cancer, it's known as the forgotten cancer. The disease is reported to be a rare, complex malignancies of the bones and soft tissue. July is a Global Sarcoma Awareness Month to shine a spotlight on the illness. We joined now by Dr. Oatile Phakathi, a South African orthopaedic oncologist. A very good morning to you, Dr. Phakathi. Thank you so much for speaking to us.
Good morning, Tsepiso and Peter. Thank you for having me. Good morning to your listeners.
So we mentioned that it is a rare illness, but obviously not unknown. So just how rare is it? And let's start off with the South African case study, because you are practicing here, but also you could just reflect on the regional and global incidence rate.
That's a difficult one because the numbers from the continent, Africa, the rest of the continent, actually haven't been reported, but globally, we know that the incidence or the occurrence of sarcoma is around about 1% of all cause cancer. What I mean by that is different forms of cancer or different types of cancer. Probably the most common, or the one that most people will know, is called carcinomas. So breast cancer, prostate cancer, and the like. And then there are cancers of the blood, leukemias, lymphomas, multiple myelomas. And as you correctly said, sarcomas are cancers that arise from what we call connective tissue, so fat, muscle, bone, nerves, and the blood vessels. And so globally, around about the incidence, about 1%. So it is rare, but not uncommon. And because of its rarity, it requires treatment at specialized centers.
All right. So I'm just wondering, its rarity, does it become a public health disadvantage? Because I'd imagine that it doesn't command the same level of attention. Also, when it comes to funding, public campaign, public education campaigns. Your thoughts on this?
Yeah, that's quite right. It's because of its rarity, it's not, front of mind, not only for policymakers and deciders, but even, the public at large. If you look at other, continents and countries, they're sort of mitigated against this by their sort of healthcare, the way it's set up. So if you look at circle of where I did my fellowship, for example, in Canada, it's a public healthcare system, and sarcomas are treated at specialized centers, as is the case if you look in the UK or other European countries. There are specialized centers, specialized referral centers that are places where these types of cancers are treated, because you need quite a high level of skill, I guess, to treat these because they're so rare. And if you see them and treat them infrequently, as you can imagine, you might not be as up to date with what steps you need to take in order to treat these cancers, as are people who are operating out of specialized centers. So yes, it is a sort of forgotten cancer, if we may, but hopefully in months like these we can raise awareness, and through doing that we can, especially on the continent, where because of the lack of, I guess, infrastructure, we do have higher rates of amputation when we compare to sort of so-called developed nations. So what I mean by that is sarcomas typically occur in your arms and legs. And if you can imagine, because these cancers arise in your arms and legs, they are the cause of many amputations. But there's the data that we do have is that sarcomas that come, or patients with sarcoma in Africa have higher rates of amputation when compared to their North American or European counterparts. So the idea behind raising awareness is, also to try and bridge that gap and get more patients to be seen earlier so that we can save more limbs and ultimately lives.
And if you could also just share with us what the symptoms are and causes, maybe, of sarcoma cancer. But also, I'm just wondering, as an orthopedic surgeon
Mhm,
or oncologist, you would see a lot of injuries, joint pain, benign growths. How do you then determine when one is in danger of being diagnosed with sarcoma? So, are there any pre-existing indicators?
mhm. I think there's a few steps to your question. Firstly, I'm a orthopedic oncologist. What that means, I typically don't treat injuries or do joint replacements. So all I do is treat lumps and bumps, be they benign or malignant, in arms and legs. So this is all I do. And the signs and symptoms, I guess you can think of in two broad groups. Sarcoma either is, like you said, primarily in bone or the soft tissue. These are two big categories, and they present slightly differently. So we're looking at primary bone sarcomas. These typically have pain associated with them. So if you start experiencing pain that's not associated with any injury, so it comes on spontaneously. This pain is usually present at night. Sometimes it's associated with a mass or a lump or bump around the affected area. So spontaneous onset of pain typically wakes you up at night. And we also, mentioned the B symptoms or the constitutional symptoms of cancer. So the fever, loss of weight, loss of appetite. These don't occur with as much frequency or as often as they do in other forms of cancer. Um, and then soft tissue sarcomas, it's usually just a mass, just a lump or a bump. And the red flag with this, it's usually painless, I should add. So it's usually a mass that is painless. Um, So a red flag would be a mass that is growing quickly. So over a few weeks or to 2 or 3 months, it grows quite quickly. It's painless and it's quite deep in your muscles. So a mass that is small, less than 5 centimeters, and closer to the skin, I think is less concerning. So if you can imagine, these symptoms are quite vague, can be quite vague, which also, you'd think that it's not of concern if something is a mass or a bump that is not particularly painful. You feel otherwise fine. And this contributes to, later health-seeking behavior. So I would say any new lump or bump or mass that you feel that is growing quickly, even if it's not painful, warrants a visit to your general practitioner or your family doctor, who will run a batch of tests, probably an X-ray, and most importantly, an MRI, and then refer you to someone like myself for further care.
Just finally, international evidence
Mm.
suggests that a lot of people have long diagnostic journeys. Is that the case
Mm.
all over, including here on the continent? And from your experience, what are some of the reasons for the delays that people experience?
Because as I said, I think I've had the good fortune of training at some of the top institutions that treat sarcoma, and the delays to treatment are much longer on the continent for a variety of reasons. Number one, we don't have enough specialists who do this. Secondly, I think of it this way. First, the regulation. So as I said, in South Africa, for example, you can get treated by anyone, anywhere for this. which is not the case in developed nations. There are dedicated treatment centers. So that's the first sort of challenge. The second, I would say, is referral patterns. So on the continent, even in South Africa, there isn't a clear referral pathway for a person with sarcoma. So if you can imagine, you suspect to have a sarcoma, where to go and the next steps and what to do aren't as clear and as directed as I say in so for example in Canada where I trained, or in the UK, or even in America where it's a private system, but it's more well known where the sarcoma treatment centers are. So I guess a strengthening of referral pathways and patterns, creating sarcoma or centers of excellence, so that people know, patients and clinicians know that if they have someone who is suspected to have a sarcoma, where to refer them to. This will help reduce the time that people take to seek, I guess, the correct or appropriate attention, medical attention. So to answer your question, there's actually quite huge disparities in the care of sarcoma and the outcomes. So outcomes meaning is that the amount of people who need amputation, which if we look at on the continent, it's about 50%. Half of people with sarcomas roundabout would end up with an amputation, whereas in developed, or let's say North America and Europe, this is about 10%, less than 10% of patients who present at the first time with a sarcoma in the extremities, arms or limbs, would require an amputation. So these are huge disparities. And even the survival expected survival, should I say, is lower on the continent than it is in America and Europe. Yeah.
Dr. Oatile Phakathi, thank you so much. Much appreciated for teaching us about sarcoma cancer, as it is Sarcoma Awareness Month. Dr. Oatile Phakathi is a South African orthopaedic oncologist. It's 8 o'clock, 7 o'clock rather. Let's take you back to the news desk for an update with Shralani Tulo Mwep.
SABC News.